morning, everyone, and thank you for joining our 2021 Mercy Care Connections Conference. We're holding virtually. I really appreciate you guys spending some time with us here today. So we are going to go ahead and get started. My name is Tara, and I'll be doing our brief introductions. So I'm going to pass it over to Jose. He's going to be our lead for this session. So take it away, Jose, and thank you so much.
Thank you, Tara. Hi, everyone. My name is Jose Rojas. I'm an employment rehab manager with Mercy Care, and welcome to day 2 of our Connections Conference. So this morning, we have a great presentation for you. It's virtual visits, how to bring healthcare into your home by video. We have 3 presenters this morning. We have Sherry Gardner, Jacqueline Bornardo, and Suzanne Gard. So before we get started, I'm just going to do a little intro regarding our speakers. So Sherry Gardner is the digital program manager with Copa Health. She's been in healthcare for over 25 years and with Copa Health for just about over a year now. She has extensive knowledge of technology and the healthcare system. She has a passion for helping individuals access quality care anytime and anywhere. And then we also have Jacqueline Bornado, the Associate Director of Health and Wellness with Copa Health. We were fortunate enough to have her do our nutrition presentation yesterday, which was fantastic. She works in behavioral health. She's been with behavioral health since about 2012, and she's been with Copa Health for the last 5 years. She has a bachelor's degree in public health from NAU, and she's a certified yoga instructor. She has a passion to helping others improve their life through health and wellness. And last but definitely not least, we have Suzanne Gard. She's a peer and family mentor with Copa Health. She's worked at Copa Health for over the last 5 years, and she's a certified peer and recovery support specialist, and she's super passionate about helping people to empower and share their stories. All right, so at this point, we're going to pass the ball over to the presenters.
Thank you, Jose. I appreciate the introduction. Welcome, everyone. I wanted to thank you for taking your time out of your day to be here and learn about video visits. During our time together, I hope that you will come away with an interest in exploring how video visits can be incorporated into your care to better serve you. Before we get started with the slides, I want to ask you all a question. And if you could type your answers into the chat box, that would be great. Keep in mind there's no right or wrong answer, and it could simply be a feeling or an emotion. When I say telehealth, what comes to mind for you? And I'll give you a minute to, think about it and post your responses.
And one tip here for the 2, make sure it's hit to host and presenter so that she can see them.
Yes, so this is Tara. I am seeing some things as video, medical assistance, meeting virtually or telephonically, healthcare in the comfort of a patient's home, not seeing a physician, convenience. So some of those are the ones coming through.
Great. Thank you, everyone. So what if I told you it was simply a way to see your provider at home in their pajamas? Not really, but I hope to bring a level of comfort to what your ideas of telehealth are and video visits. And while we spend some time together, we're going to be discussing the following items. What is telehealth? The history and the future of telehealth. The benefits of video visits. What COPA members are saying. And we're going to get into a couple of our programs, which is the Health and Wellness Program and the peer and family supports. To start, we wanted to provide you with a foundation of the terms and the words that we use. The term tele is mainly used to form compound words like telephone or television. Telehealth is tele is typically added in front of another word, and it means at a distance. So television is seeing someone or something from a distance. So telehealth video visits are really just a way to use technology to see and speak to a provider or caregiver when you're not in the same physical location. And in order to help you improve your mental, physical, and or emotional well-being. As you navigate the world of video visits, you will hear and see a lot of telewords. Telehealth, it incorporates all telehealth, be it mental, physical, emotional. Telemedicine is typically more specialized for clinical medicine. Teletherapy is all forms of therapy. It can be behavioral, it can be speech, it can be physical. Telepsychiatry is specific to psychiatry. Telewellness, it includes nutrition and diet, fitness and exercise, sleep and support. So all of these telewords really are just different forms of telehealth. The term tele gave us the starting point, and now I'm going to take you back in time over 3,000 years to learn more about the history behind the terms, beginning with the optical telegraph. This optical telegraph is basically a way to send messages through visual signals. So a long, long time ago, we're talking 900 BCE, there was the use of fire and smoke by both the Chinese and the Native Americans, and they used this to communicate predetermined messages. When I say predetermined messages, they were 3 puffs of smoke meant danger. 2 puffs of smoke meant all clear. So they were able to relay a message as far as 300 miles, and it only took a few hours to communicate with their neighbor. We actually still use this form of communication today. When a new pope is chosen, they have either black-gray smoke, which means there isn't a pope, or they have white smoke, which means a pope has been elected. The Greeks in 150 BCE further developed the smoke signal communication and turned it into communicating with torches. And they were able to figure out a method to send text messages using torch fire signals. So they would place the torches and use a mechanism to decipher where the torches were to mean different letters in the alphabet. In 1973, the French had the first successful large-scale communication network using a device called a semaphore. It allowed the transmission of messages faster than horse riding messengers could carry. These symbols could 3 symbols could be sent a minute. So 3 symbols in 1 minute, and it would take about 9 minutes for a single symbol to travel 125 miles. You also needed a complex code book to translate the symbols into words. So as you can see, things have developed over time. And it wasn't until the arrival of the electrical telegraph in 1844 that sending text over a long distance became possible. This was the possibility to send 66 words per minute over the distance of the telegraph line, the first long distance line being 44 miles. So much like we have a hard time with change and adapting to new technology, so did the French, and they continued to use the semaphore for over 10 more years. And like the telegraph, a telephone uses electricity flowing through wires, but it sends sound instead of code. By March of 1876, the goal of creating a device that would transmit the sound of speech electronically was realized. The first words over the telephone from Alexander Graham Bell to his assistant, Watson, "Mr. Watson, come here, I want you." Those words were very well known, but what isn't very well known is that Alexander was asking his assistant to come to him because he had spilled battery acid on his clothes and he needed medical attention, thereby making this not just the first telephone call, but also the first sign pointing towards the utilization of telehealth. And this was in 1876. With the invention of the telephone, many people began to predict how it would evolve healthcare. And a few years later, in 1879, there was an article in a famous medical journal called The Lancet that talked about using the telephone to reduce unnecessary office visits. In 1905, the first telecardiogram was recorded and sent by telephone from a laboratory to a hospital to measure the electrical signals of a patient's heart. In the 1920s, radio started being used for telemedicine, for physicians on land to treat patients on board ships at sea. Predictions for the future in treating patients continue to evolve, like this prediction that you see on the screen now. In 1925, it was called a teledactyl. What it meant is that they were able to wanted to be able to use a remote monitoring device that would make it possible for a provider to see, speak, and touch patients at a distance. In the 1950s and 60s, only 30 years after the prediction of the teledactyl, saw psychiatry take telehealth to the next level by using a television monitor and closed caption screens to treat patients remotely. Even the Jetsons got into predicting how telehealth would transform seeing the doctor over video. Jose, if you would play the video, please.
Elroy, why aren't you ready for school?
I don't feel good, Mom. I think I'm coming down with Venus virus.
Venus virus, eh? Last week you said it was Martian mumps. Anything to miss the space calculus test.
I tell you, I'm sick. Oh, this is it. It's glowing black. Quick, where's a pencil? I gotta make up my will.
All right, hold on. Just hold on. I'll call the doctor. Calling Dr. Racy. Dr. Ken Racy.
Yes, Mrs. Jetson. Somebody got a pain in the tummy tum-tum?
It's Elroy, doctor. I think it's the Venus virus this time.
Venus virus? Oh, that can be catching. All righty, Elroy. This is your dedicated physician speaking. Stick out your tongue. Uh-huh. Oh, my.
Well, what do you see, doctor?
2 dozen gumdrops, a pastrami sandwich, half a pizza.
Elroy, for breakfast?
Well, you see, I thought it was my last day on Earth.
Yes, well, it pains me to tell you, but there's only one known cure.
What's that?
A full day at school. You're fine.
Oh, boy.
Elroy! Thank you, Dr. Racy. Sorry to call you needlessly.
Think nothing of it, madam. It's my duty as the nation's #1 dedicated physician. Which reminds me, one house call, the usual fee. Don't hurry on bill. Tomorrow morning will be fine. Happy medicine.
Well, Elroy, you just spent your father's raise.
Thank you, Jose. So the development of telehealth was still in its futuristic stage, where it was just a thought in somebody's mind that it could actually be used for your in-home care. Telehealth continued to remain very specialized in its usage until the 1970s and 80s, when NASA got involved. From monitoring their astronauts in space to linking Arizona's Papago Indian Reservation with experts in Tucson and Phoenix. From this point forward, telehealth gained a slow but steady footing in remote and rural care, expanding into additional specialties like radiology. In 1993, the telehealth gained, in 1993, the World Wide Web was made publicly available. And this changed the world of healthcare, allowing greater access, more conveniently, and it took 5 years, only 5 years, to reach 50 million users. In comparison, in the 1920s, when radio was popular, it took 38 years for the same number of users to become radio aficionados. At the same time, the ATA, which is also known as the American Telemedicine Association, was created to promote health and care through the use of telecommunications technology, and they developed the standards and guidelines for care, and they are around today. Which brings us to the 21st century and the very rapid evolution of technology. It has been unfolding for the past 21 years. 2017 marked the year that secure text messaging was allowed as part of telehealth. So back in 2000, we had the first camera phone. In 2003, they began expanding telehealth regulations and better define what telehealth was so that more care providers could use telehealth. In 2007, we had the first iPhone. So between 2015 and 2017, telehealth expanded to include the phone, your email, secure text messaging, and videos. Now in 2020, can anyone tell us why between February and April, telehealth video visits grew 2,000%? So that's last year between February and April. If you could go ahead and give us a guess, that would be great. Great, thank you guys. Yes. COVID-19. So it wasn't until last year that telehealth was forced into the mainstream, which brings us to present day, where Facebook is providing free satellite internet to remote parts of Africa, which gives them access to care they never had unless it was provided in person by groups like Doctors Without Borders. SpaceX is in the process of launching their network of satellites to be able to provide satellite internet to the whole world. The FCC, or Federal Communications Commission, in response to COVID, developed the Emergency Broadband Benefit, which is a program to help families and households struggling to afford internet service. All of these developments are allowing for telehealth to be more accessible and more affordable and have more support than ever before. Telehealth has been evolving for over 3,000 years. And since most of us haven't had the same amount of time to adjust and learn to use it, it's expected that we'll have questions and even experience a few bumps adjusting to all the technology. We also acknowledge that telehealth sessions can sometimes feel awkward or be outside of your comfort zone. So at Copa Health, we've been working with staff and members to help smooth out those bumps by taking the time to individually ask you what your comfort levels are and identifying the types of technology you need so that you can have access to the telehealth services we provide. There are multiple layers of support and education that we're using both visually and verbally. We have expanded our education to include how-to videos. And I'm going to show you an example of one of these videos that we are providing to our members.
Hi, I'm Kathy, Copa Health's care team helper. Thank you for being part of the Copa Health family. We hope this message finds you safe and well. In an effort to help you stay safe and well, Copa Health has expanded the ways we can connect with you through telehealth. Telehealth is a fun and easy way to use technology to see and speak with your care team right from the comfort and safety of your home or anywhere you choose. We are using an application called Zoom. Zoom allows you to safely and securely use a camera and microphone to see and speak with your care team. And guess what? It's free. Let's review to make sure you have access to the technology you need for Zoom. You can use any of these devices to Zoom: a cell phone, Apple iPhone or Android, tablet, Apple iPad or Android, laptop computer with camera and microphone, and desktop computer with camera and microphone. In addition to the device, you will also need access to Wi-Fi or a cellular data plan. We have a series of videos to help you get started using the technology you have available, including how to schedule your appointment, how to download and test Zoom from your available device, how to attend your telehealth appointment using your available device, tips and tricks for using Zoom during your appointment. Please watch all the videos that will help you the most. If you want to use telehealth but don't have the right technology or need more help getting set up, not to worry, we can help. Please contact your COPA Care team and they can provide the guidance and assistance you need. On behalf of your care team, we can't wait to see you at your next telehealth visit.
So at Telehealth, we are continuing to evolve, and telehealth will continue to evolve with all sorts of medical and physical and emotional and wellness. We want to make sure that our members and that everyone here on the call today understand what the benefits of video visits are, knowing that it's new, but it will allow you to also be more flexible and reduce stress and anxiety when it comes to your healthcare needs. When you're sick, you can stay home. You may not have to take time off work or arrange for childcare. All of us face time constraints in our day-to-day lives, and having to physically show up to a health clinic can be daunting. But using telehealth or video visits can free up some of that time. Transportation isn't needed. So you don't have to go to crowded waiting rooms, and people with social anxieties or agoraphobia or similar diagnoses can avoid the public busy spaces that cause them stress and anxiety. You may be traveling or across the state and unable to make it to the office, but if you're using a telehealth video visit, you'll still be able to make your appointment and you won't miss a group session. Sometimes public transportation is not available everywhere, and it typically runs on a set schedule. So it's only suitable if a person can safely get to a pickup point and it is available when the person needs it. And then there's transportation services. You typically need to schedule in advance, and they're not always available everywhere, and it can be expensive, like ride sharing or Uber and Lyft. And then for those who have wheelchairs, those types of services are not mobile friendly. So having the ability to do a video visit can allow you to remain consistent with your treatment. It can strengthen your relationship with your providers because you'll be seeing them more often. You'll have more frequent touch points. It also can provide your family and caregivers a way to be more involved. And it gives you access to a broader range of care. I do want to mention that video visits are not a substitute when a physical in-person exam is needed, but it is a definite solution to support your holistic health. There are many benefits to incorporating video visits as part of your care, but you don't have to take my word for it. Here are some of the words directly from our members. So our members are saying at first they struggled and their team was able to help them. They were able to get an iPad. They taught them through downloading the information. And at the end of their coaching period, they were even able to add computer skills to their resume, which is a definite bonus that they never thought that they would be able to have. And along with all of these benefits that they learned throughout their journey using video visits, their depression has decreased. So for this particular member, their story was a long one, and I tried to trim it down as much as possible to share with you all the benefits that one person got out of telehealth. Another one of our members said that it gave services to those who needed it in the moment. So telehealth not only can be used, during scheduled visits, but it can also be used on demand. So if you're ever in need and you need to reach out, telehealth or video visits is an immediate way that you can seek out services. We've also had members say that it's better than face-to-face. So some prefer not having to go out into the public, not having to travel to their doctor, but being in the comfort of their very own living room. And then others, while we were in the midst of the pandemic, it allowed them to feel connected to the rest of the world. So I want to thank everyone for your time in learning about telehealth and the history. Hopefully you enjoyed it and got a little bit out of it and learned something that you didn't necessarily know before. I'm going to turn over to Jackie Bordenaro from our Health and Wellness, who is going to go over our Health and Wellness program at Copa Health.
Okay, cool. Thanks, Sherry. I loved hearing all the benefits of telehealth. There's just so many that you just kind of don't even think of. So thanks for sharing that with us. I'll just ask you to change the slide when I'm ready, if that's cool.
Great, thank you.
All right. So some of you may have been here yesterday and recognized me from my nutrition presentation. I'm here today to talk about the health and wellness team at Copa Health. So we're a team of wellness coaches and nutritionists, and the team that we have are either certified nutritionists, they may have bachelor's degrees in, exercise science, public health, specifically health coaching or specific to nutrition. So everyone knows their stuff. And we offer video services for all of the following things: one-to-one health coaching, one-to-one nutrition coaching. We do smoking cessation, diabetes, and chronic disease management. We also offer physical activity and exercise, nutrition, and stress management, just to name a few. So if Sherry, you can go to the next slide for me. Great, thank you. So our health coaching approach is a little bit different than you may think. We never tell anybody what to do. We're there to coach, encourage, and support. So with you guys, we brainstorm ideas about your wellness goals, and then we help you come up with things to achieve those goals. We also can help you find solutions to any health conditions or concerns that you may have. So, if that means like getting you connected with a primary care provider or providing you some education on a chronic disease that you may be struggling with. And we do goal setting, but goal setting is like a big thing, right? So you have a big goal and you want to reach it. So you have to do little steps, baby steps, small steps, whatever you may say, to reach that large goal. And we call that action planning. So we do action planning with you guys, and that helps you reach the big picture goal. And then we also are there to help motivate you. Motivation can be very hard, especially if you're feeling depressed or anxious, and you have a lot going on in your life. Motivation isn't easy. So that's also what we're there for, to provide that positive energy, encouragement, to get you motivated to reach your goals, your health and wellness goals. So Sherry, yeah, thank you. So All the services I talked about, we provide through phone calls and Zoom video visits, which has been wonderful. And we have actually groups that we run through our Zoom video visits. So we have exercise groups, and our exercise groups include chair exercise, which is, for people who are looking for something a little bit more low impact, or maybe they have previous injuries or mobility issues. And then we also offer something that we like to call fitness pump, and that's a little bit more high intensity, less low impact, but our wellness coaches are also trained to provide any modifications that anybody needs if they feel something is too intense or they're unable to do that. And then, as Jose shared earlier in my bio, I am a certified yoga instructor. So I also run a Zoom yoga group as well, which is a lot of fun. And then we also have a nutrition group that's run by our certified nutritionists, and it provides education on different nutrition topics. It's just a wonderful thing. So we've got physical activity groups, and then we've got educational groups regarding health and wellness. All right, Sherry. Okay, so we all went through COVID, and we're still going through some of it a little bit. Things are getting better, but when COVID began last year in mid-March 2020, our engagement with you guys did not stop. We didn't stop engaging with people. We started with just phone calls. It was hard at first because people didn't know what was going on. Everyone kept asking, when are we going to go back? There was a lot of unknowns, right? But you guys were all stuck at home and, looking for things to do. We were bored. There was nothing to do outside of our homes. So in that aspect, everyone started to, answer the phone calls, and they were excited to hear from us. And we noticed that people were making healthy lifestyle changes and starting to reach their goals. They had extra time. They wanted to work on something so that they could get their mind off everything else going on in the world. So we were headed for success. Thanks, Sherry. So then we decided, we needed to do some type of video visit with people and offer that a little bit more. There was resistance at first because it was a big change, and I think that technology can kind of be scary if you don't know how to use it. So we moved past that though. So by August, we started to promote and run our Zoom health and wellness groups that I spoke about before. And, people were wanting to be back in person, but we told them, we don't know when this is going to happen. So this is kind of our option right now, and let's see how it goes. And people started to jump right in. So the health and wellness groups that we offer on Zoom, they blossomed. People were engaging and they were enjoying every aspect of the Zoom groups that we facilitated. It was very exciting to see, and it just kept growing. And we actually probably have more people participating via Zoom now than we did ever in person, which is just wild to me, but extremely exciting at the same time. So on average, we have anywhere from 10 to 15 members participating weekly in our groups. And I've also got some stories from people. I know Sherry shared some member stories as well, but I'll give some from my yoga group specifically. So I had a gentleman in my yoga group a couple weeks ago, and he had never done yoga before, but he's been coming every week and he loves it. And he tells me every week that he enjoys coming and it's great. And he was having some neck pain. And after group one day, he said his neck pain was gone. And that's when he realized, hey, yoga is really good for my body. So that was very exciting to hear and see. And then I had another another woman, she had attended a yoga group previously before coming to mine, and she really liked how I demonstrated all of the poses on the video and then offered coaching tips for her to correct her poses if she was doing them incorrectly. And she said she never had anyone coach her like that before, and she was just really excited. And she's been coming every week too, and she has some mobility issues, so she feels like it's helping with that as well. It's just really exciting to see people enjoying and participating in these video visits because it's something new, and we know that new can be scary and also change can be scary. But we are here to help and move it along in a positive light and have people succeed with it. So it's very exciting.
Thank you so much, Jackie.
Yeah, thanks for having me. I'm happy to be here, and I'm actually unfortunately not going to be able to sit in the rest of the presentation. I have to go do my yoga group, but so I'm going to bounce off. But thank you so much, everyone. I hope that you all enjoyed it. If you have any questions, you can ask them now regarding health and wellness, so I can answer them before I go, if that's okay. So I don't know who's looking at the Q&A. Was it Angela?
Hi, yes, Jackie, it's Angela.
Okay.
I don't see any right now.
Okay.
Does anybody have any questions for Jackie at this time?
Currently, there's nothing in the chat or the Q&A.
Yeah.
Okay, cool. Well, if anyone does have questions later that you need to pass along, just let me know. Shoot me an email. We can get questions answered.
Okay.
All right, thank you guys.
Thank you very much, Jackie.
Thank you so much.
And next up is going to be Suzanne. Suzanne is going to speak to you about our peer and family supports and the video visit programs that are going on with her groups.
All right, so hello, I'm Suzanne Gard. I am a certified peer and family mentor. And if you haven't heard of the peer services or peer support and family support, basically we as peers also have an SMI determination. We belong to a clinic. We're in recovery. So this is something that we're able to share with the members, that shared experience. And just the knowledge that somebody has walked the same path as you with struggling with mental illness it's such a comfort. There's really no words for it. I wish that I would have known what peer support was when I, was determined SMI and going through all of this, but I didn't know what it was. And when I found out, I was like, I want to do that. And same with the family support. So basically with the family groups, it's family members or friends even who have a loved one with serious mental illness, and they just get together and kind of help each other cope and share their experiences. And we were doing, of course, all of these in person, and then COVID hit. And for a while, I think there's a couple of us facilitators that were trying Zoom, but we were all at, I think, 6 different clinics. And over time, we started working from home and we weren't able to reach our members. They stopped answering the phone because a lot of, I know the people I worked with were coming to groups every, 5 days a week. And when that just stopped, the isolation begins, the depression gets worse, all of these things. So it got to the point where people just stopped answering their phones. And it had actually a personal effect on me. This is, I do this because I love it. So it gets me out of bed every day. And when I wasn't able to offer support and I was being so caught up in being concerned for the members, I started to struggle to get out of bed, which is something I had not experienced for 6 years or so. And so at that point, it's like something needs to happen. So what do we do? And I made a call to one of my supervisors and said, hey, can I get some of the peer and family mentors together? So we can kind of discuss ideas on what we can do, right? We don't know when groups are opening up. We need to be there to support our people. That is our passion, that's our jobs, and we're not able to do that. So I invited about 20 peer and family mentors for a Zoom call. We are all very new to Zoom. It was very uncomfortable. And I think about 9 showed up. And from there, we created what we call COPA Live, and it is our online Zoom groups. And the next slide, please. Thank you. So these other facilitators, they just jumped on board. I had never met them. We were from 6 different clinics, but we all wanted to solve the same barrier. You know, how do we get people engaged? There's fear of Zoom. They just don't know what it is. They're going to wait for in-person groups to come, which everyone kept thinking, oh, it's going to be next week or next week, you know. And so we just got started. We started making phone calls to people that answered and invited them to join the groups. And we definitely struggled like getting this off the ground, because what worked for in-person groups certainly was not working out online. One of the biggest ones was bingo for in-person groups, just an example. And we're going, okay, so anyone can join from any clinic, a member can join these groups. But with bingo, you'd win prizes and you'd leave with the prizes. So how do you do bingo? So we left that one out. We left out art, things that just seemed like it wasn't going to work. And it was a lot of trial and error. So coping skills, I think, was our most popular one at first. And then we just kind of continued to grow from there. There's a lot of anxiety. We tried making it fun. Explained that we as facilitators were new to Zoom, so let's just mess up and let that be okay. We learned a lot about mute. That is, man, if you guys have been on Zoom at all, you know that mute is so important because people have dogs barking in the background. You can't hear anything. So it was such this like learning process that was really amazing to see the support staff as well as the members figuring this out together. So it's really been fun. And we do have quite a few groups. We have 20 some groups. I'm just going to name a few of them. Every morning I facilitate a makeup group, and it's kind of a get ready with me, teaching, all kinds of makeup tricks and things like that. And that is every morning we do that one. We also have a self-esteem group. We've just started a book club. We have men and women's group. We do still have coping skills. And we've actually fairly recently started an art group. We have open art, and then we have kind of scheduled art that lasts a month. And we did figure out bingo. So that's, we're pretty proud of that. And the exciting part is it doesn't matter what clinic you go to, you can go to any of these groups that are provided online. And all the facilitators, again, are coming from these 6 different locations. And so we've really kind of created this online campus almost. And so we do offer one-on-one support. And instead of now only being able to talk to your peer support or the family mentor at your clinic, you can talk to this variety of 9 people. So if you connect with someone in the women's group, for example, you can speak with them for their, your one-on-ones. So it's really opened up a whole lot more, I think. And next slide, please. Okay, so the difference between in-person versus video visits is, like I was saying, we do have more access to groups that we won't have in person. At some point, we will be opening in-person groups again, but things like the makeup group, that one, we've got to wear masks, things like that, so that will stay online. We will continue to basically keep most of our schedule as well, because we do have people, like Sherry explained in the beginning, that have barriers preventing them from coming in, and things of that nature. And again, of course, being in the comfort of your own home, that is, that's an awesome thing. But I'm personally kind of tired of being dressed fancy from the top up, wearing my sweats. So that's not cute when I forget to go grab something and then, the members get to see that I'm not fully dressed. So, I've been getting a little bit more dressed up lately. And then next slide, please. So again, this here just says, just do it. We did have a lot of resistance. Like I said, people are uncomfortable with the newness of it. I'm not tech savvy, has been a lot of the responses. And the fears and the barriers that the members had were basically all the same. It's the unknown. Or I'm just going to wait for in-person groups. And now that we've had the engagement that we've had and it continues to grow, it's amazing. It's really, truly amazing what's happened. I'll speak to the makeup group since that's the one I do. Some of the response that I've had from the members is, this is my reason for getting out of bed in the morning. I had one girl tell me, sorry, she told me, I took a shower last night for the first time in a week because I wanted to be ready for this group in the morning. So a lot of responses like that. I don't want to say anymore because I am now embarrassed because I'm crying, but it's been amazing. They talk about the confidence that they have, the camaraderie. We'll have members from the makeup group who attend different groups and they invite their friends from other clinics. They're like, you've got to check this out. And it's been awesome. And we've truly created this great community. As I had said before, the members have been really as big a part of this as the staff on getting this created. There's no instructions. No one said, here, follow this plan and do it. We just kind of all came together and did it. And as far as, the team, I do want to speak to my team. They've been amazing. Like, they just came together and created something out of nothing. And it's been amazing. And I'm very grateful for all the support. It's been awesome. And so I just ask that, if you're curious about it at all, just jump in and see if you like it. We've got tons of groups to choose from. And I haven't heard anything negative except for when our in-person group's going to start back up is the biggest question. But these groups are here to stay. They will be growing, and we will be adding more in the future. Good.
All right, thank you so much. All right, we want to open it up at this time for any questions. I see one new one in the chat. Someone's asking, it's very interesting what you're doing. What's the center called and where is it located?
So this is through COPA Health, and we are basically a virtual campus. So as long as you are a member of any one of COPA Health's campuses, you can join. And your case manager or the peer support on your team, they'll have the information. We do have a schedule that comes out and every month for all the groups, and it has the Zoom codes on it. You can just pick one you like, jump in. You do not need to have your video on. That's one thing that people get kind of nervous about coming in. They're not comfortable being on screen, all of, whatever. So you come in muted with no video and just watch,
And the main campus is located at 924 North Country Club Drive in Mesa. So that is the main campus, but we have several satellite campuses throughout northern Arizona and the Valley, east and west, and central.
Awesome. I just want to comment. Is there a way a member could reach out to you to get a hold of that calendar, maybe get it emailed to them so that way they know when things are occurring? If you can put that in the chat, that would be great. Are you able to do that? Angela, are you seeing any other questions or chat comments?
Yes, I just saw one come in that says it's from Greg Mingus, and it says that he has Mercy Care, he loves it, and he's with CBI, and he wants to attend the Zoom groups with COPA, and he wants to know if he can. And Greg also said that the makeup group is cool and that they love it.
Yeah, so how does that work if someone is at another clinic? Is this something that they can join?
So they would need to become a COPA member. So they would need to be seen at COPA clinics in order to attend the COPA group sessions.
Okay.
Just put my email on there.
And if they have questions about becoming a COPA member, they can also reach out to 48, and I'll put this in the chat, but it's 480-969-3800. Again, that's
Awesome.
480-969-3800.
And then one of the other comments in the Q&A is from Lori Munn. This is so creative. This is so creative and solution oriented, and innovative and compassionate. And she loves us so much and says, well done. I'd like to say the same, not all, like I piggyback on that and said, you guys, like this was great and very, very informative, and just being able to produce, to collectively come together for the members like that, like in such a time of need, like that just, I worked outpatient for a long time and I just worried about it the last year. So I'm just grateful to know that all this stuff was going on.
Yeah, it's been amazing. Like I can't say enough about the team. I don't need to take the time, but these people didn't know me at all. You know, we just had the same goal and we were like, what do we do? Because what we're trying isn't working. And the ideas that have come out of everyone and just making this happen. I've never worked with a team like this. Everyone kind of has their own special thing that makes them just the best at, you know, this part of this whole team. So they're amazing. It's been amazing. I've loved every minute of it.
All right, I see another question in the chat. Prior to this question, I wanted to ask, okay, so let's say we have a member that's receiving their behavioral health services from CBI. They have their case manager, their RS, their physician, but they want to do a referral to participate in the health and wellness groups with you guys. Are they able to do so?
Unfortunately, you do need to have your clinic or your care team be a part of COPA Health to be able to attend.
Okay, thank you for clarifying that. And then also on the chat, I see a question. What insurance is needed to attend?
So we do take Mercy Care. We also take Access. So if you're, I'm assuming if you're part of this presentation, you have one of the other.
Okay, thank you so much.
And then in the Q&A, we have a question from Monica wondering how you got the bingo to work and if you can tell us how you did that.
Yeah, bingo, man. So really what we had to do through this process is get our brains away from how things were before. And that was the hardest part. Like we just had to just dump everything we knew about groups and get creative. And so it started with, you know, I photocopied a ridiculous amount of bingo cards, and it was coping skills bingos, or bingo, and sent that off to one of the clinics for one of those facilitators to try. And then those were then sent out to members or emailed, things like that. And they would use things from home to fill those squares. And then as far as the gifts and prizes, that we had to change a little bit too. And so basically it's collected over a week of 25 cents or $1 or whatever it is, and it's put onto a gift card, I believe for like Family Dollar, things like that, 99-cent store. And then those are then sent to the members at the end of the week so that they can collect those and then get whatever it is that they're wanting. And so we now have a second bingo group. I don't think we have coping skills bingo anymore. But Destiny does our newest bingo, and I guess I haven't seen this yet. I've only heard about it last week. And I guess she gets dressed up and she's kind of like in character. So I'm excited to go check that one out and kind of spy on that one. So they've done an amazing job. Bingo is something that I was not hands-on with all that much. They made it happen. It's very impressive.
And then we have another question from Penny. Will there be an opportunity in the future to expand this to external referrals to this program? So like outside providers, I guess.
We are looking into it. We are expanding our services. So yes, I don't know when, and I don't know exactly how at this point, but right now, what I'll do is get information and get this back to the facilitators on how exactly everyone can become a COPA member and what the process is specifically.
Okay.
Thank you. I want to thank you all for kicking us off today for day 2 with this great presentation. It was awesome. You guys are doing some great innovative things for our members. So thank you so much.
Thank you all so much for joining us. On behalf of Mercy Care, thank you so much